and they're like, what is
Never heard
this?
of sugar in your soil.
Okay, so most of the time, the people
Control
that
your
they're,
emotions,
that
not
they've
break
been
under pressure.
painted
All this
is
stuff is
We are one of the very few
meditating,
businesses, organizations
you know,
where you
so
can shop
really
great
online.
tips already off the bat, and we're just starting.
Go to Top Box.
Hello and welcome to Healthier Habits, a podcast that discusses challenges and solutions when it comes to health and wellness, as well as connecting you to some local resources in Chicago. My name is Cassandra Zumba.
And I am Yakwache and will be your host. We are the Policy, System, and Environmental Coordinators here at the Chicago Partnership for Health Promotion, a program from the Office of Community Engagement and Neighborhood Health Partnerships at UIC.
Jessica Martinez is the Director of Nutrition Services at Catholic Charities wicgrocery, with previous experience in the mental health and eating disorder sector. Jessica has a passion for supporting clients in building a healthier relationship with food. Jessica uses this unique expertise to foster a compassionate and comprehensive approach to community nutrition. Hi, Jessica. How are you doing?
Hey, I'm doing great. Happy to be here.
I'm glad you were able to join us today. I know there was a little bit of, hold back today.
Better late than never.
Yes. So you're on time. It's perfect.
Yeah.
So we want to start with a little icebreaker here. So since your sector's focused on nutrition,
Yep.
so are we. We talk about My Plate a lot. So we want to just see how much you remember or any true or false within My Plate.
Okay.
So the food pyramid is the latest dietary graphic guideline.
Sure. Sounds my plate.
Where's My Plate? A lot of people forget that we transitioned from the food pyramid now to an actual more practical way of knowing what we should be eating.
Thankfully, because the food pyramid was insane.
Yeah.
Oh, it was confusing for me. It was. I remember seeing it like a graphic in elementary school. I'm like, I don't know the difference. Is the base the most important because it like holds everything together,
Why
or
is
is
it
the
a
top?
pyramid?
Yeah. Or is the peak better because it's first,
Totally.
But I feel like it's now more sensible and more comfortable.
Absolutely.
How many food groups are in My Plate?
5.
See, you remember your stuff. Can you name 2 out of the 5?
Yeah, absolutely. Fruits and vegetables, which are the most important. And then I love dairy, so I'll add a third one, but dairy is my personal favorite.
And I love the fruit and vegetable section because you can offset one or the other if you like more of a fruit version or the vegetable version. So some people just get stuck on like, it has to be 1/4. I'm like,
Yeah.
you can go back and forth.
Yeah, absolutely.
Maybe for breakfast you want a little bit more fruits than you do vegetables.
Absolutely, I agree.
What's going to be your lunch today? I know we're a little bit later in the day.
Oh.
Taking consideration the My Plate, okay?
I should have an idea. Honestly, I would go a Subway sandwich because like you hit everything so easily, right? So that's probably gonna be my go-to. And price-wise, even though I feel like they're a bit of price gouging now, it's still reasonable
Inflation.
compared to Panera or Chipotle, which you're not leaving without spending $20, $25, which is insane.
Yeah.
So I'll meet all my food groups and stay within my budget.
Yep. And I love your response because it's super realistic.
Yeah.
Because, I'm going to tell you what I'm going to have later, but it is going to be later in the day. You obviously came all the way over here to meet us up, so you do need something a little bit more on the go.
Yeah.
But it's not always easy to do the whole My Plate, but if you can find alternatives or your go-to meal, that'd be great. Yeah, what about you? What do you think you're going to have?
So, I actually don't know yet, but if I had to come up with something, I'm thinking maybe like a grilled chicken sandwich with like some mixed greens, some onions, some tomatoes, one of the cherry tomatoes.
Sounds good.
I do like to sprinkle a little almonds in the salad as well. And maybe, I usually go with water, but I guess if I have to do some dairy, I'll go with some almond milk or something.
Okay. All right.
That sounds delicious.
Yes, I actually do get that, though. I didn't just make that up. That's actually a meal I do enjoy eating.
Yeah, it sounds great.
I guess today, because we're having a busier day than usual, my go-to, like, simple version would be a quesadilla.
Oh, yeah.
And I feel like the tortilla can cover the grain portion, right? The cheese, the dairy, and then, put a little sauteed vegetables, beans, of course, because that's always in my household for the protein. And then, if I still need to snack on something other than the veggies that I put in, I bought some strawberries that were on sale.
nice.
So they're coming up.
And you got to use them.
Exactly, because they're going to go bad quick.
I stopped getting strawberry or berries in general, specifically strawberries. Every time I look at them, I'm like, oh, they're on sale. They look so good. They look so ripe and plump. And then I swear the next day, I'm like, they're shriveled.
Yeah.
What happened? And now I can eat them. So now I've decided to take a step away.
Well,
But
I gave it a couple days in the fridge just to see if I just have them just like that. But as soon as like 2 or 3 days go, I cut them up and put them in the freezer.
oh, that's smart.
That way it lasts a little longer, and then I can make a smoothie out of it.
That's smart.
Especially because it's gonna be
Yeah,
you're running in the morning sometimes,
Yeah.
breakfast and stuff like that. So
genius.
Yeah.
Love it.
you gotta save cash wherever you
Absolutely. Especially when they're $5 for some berries. That's just
Yes, no. Right now, whatever's on sale is what I'm buying.
Yep. Absolutely.
And that kind of brings us to this episode today about food insecurity
Absolutely.
and ways to kind of talk about those disparities and
Yep.
how we can address them as well. So, can you talk a little bit about WIC's mission?
Yeah, so I'm very new to WIC. It's something that I kind of fell into previously, like you had mentioned in the top of the hour. Like I come from mental health, so I worked with eating disorders and disordered eating as just a regular dietitian, but then eventually as the director of nutrition. And that's a totally different world. You're dealing with a lot of emotions around food, a lot of broken relationships around food, but food insecurity, although it does play some parts for some people, it's not prevalent, right? Especially because the space I was in was private pay. People weren't on Medicaid or anything like that. They had private insurance. Like they had no issues having access to food. It was their dynamic and relationship around food that I was working on with them. Moving into wicgrocery, when I was in school, I learned about WIC maybe for like 30 minutes in one class, to be very honest. I went into my interview and they asked me, they're like, what do you know about WIC? And I'm like, I'm going to be really honest. I could tell you nothing other than the name of the acronym, like, women, infants, children. Beyond that, I don't really know what it is other than, when you're a dietitian, you know that sector is really challenging to work in because the turnover is really high. But other than that, I was like, I don't really know much. So over this past year, because I've been with them for about a year, I've learned a lot about WIC and its mission. And really what it is a supplement. So when you think of SNAP, right, it's kind of like you sign up for SNAP, you get the benefits, you can use them in any way you want as long as it's within the bounds of how you can use those dollars, and then you get recertified each year. WIC is much more intensive, and there's a point behind it. The goal is to improve the health and nutrition of low income women, pregnant women, and their children, right? So infants and children under 5. It's not meant to be the sole source of nutrition. It's meant to provide a supplement of nutritious foods in addition to quality touches with the providers. So when you're on WIC, you have to go to the doctor. You have to get your labs done. Your children, they need to have their labs, their height, their weight when they come to their appointment. Those things are required to get and maintain your WIC benefits. And then they need to see you about every 3 months. So you get certified, and then 3 months later, you have to come in for nutrition education because that's a big piece too. And then in the middle of the year, you have to come and make sure that you have done all of your doctor's appointments, that your child's on track, that you have all of the labs that you need, and then you also get nutrition education, and then it kind of keeps going in that cycle every year. So if the clients are not following up on that, they don't remain in the program. So it's something that is supplemental, but really we try to reach populations that really need and want the service.
Yeah, I think it's really important that you guys also follow up with them because
we as non-for-profit organization can do as much as we can in giving the resources and education.
Yeah.
But if people don't follow up from either side to show that they really care and it's really important, things can fall through the cracks.
Absolutely.
And I also feel like your particular background on disordered eating is so valuable and so important. We recently had a conference, and one of the seminars was about language and food relationships as well, and how, there's not necessarily good things or bad things, but the way you state them can make a big effect on how people receive that information.
Absolutely. And I want to clarify at the top, right? Because I know we might get to this eventually, but just to kind of set the stage is that WIC clinics are the entities that do that process that I talked about, right? So certified benefits, follow up, essentially give the benefits, right? Give them the benefit card. And then my role is WIC Grocery. So WIC Grocery is actually something that's been around for 30 years. It came about because there was a lot of fraud with WIC in Chicago. A lot of selling vouchers, and people weren't getting the food, right? Like they were.
Chicago is
right.
with some of those things.
So in order to stop that, right, or limit that fraud, the state partnered with Catholic Charities to create these WIC groceries. And we are 100% WIC approved products. You can only come in and shop with WIC benefits. So when it was the vouchers, only we redeemed the vouchers. There was limited relationships with other vendors. And so that really cut a lot of the fraud that was happening. And then we just continued to grow, right? That relationship was really successful. We were in low access communities that had food deserts that didn't have grocery stores. So we were a safe place that they can come and redeem their WIC benefits. But then also they know that when they went there, everything was WIC approved, which is a big pain point for a lot of people. When that shifted is when we got the EBT card. So that happened in, I think, 2019. Then there wasn't the vouchers anymore. And so when they moved away from that, the market brought in, so they could go to any vendor, like they could go to Walmart, they could go to Target, the similar with that they would with the SNAP. And so that shift was very interesting because now we had this base clientele that isn't necessarily guaranteed anymore. Right. So then we had to really kind of think about how do we better serve moms? And so when you think about WIC Grocery, we have 14 locations across the Chicagoland area, again, focused in areas that are not served by typical vendors. They don't have grocery stores or fresh markets around them. And we focus on not only the redemption, but also providing nutrition education. We have cooking courses. We have a variety of wraparound supports that we provide. So just to kind of delineate, we have a very close relationship with the WIC clinics, and we do more on the redeeming benefits and so distribution of food.
Right. WIC grocery locations are very welcoming. Yeah. I've noticed, because I've attended a couple of them, and I like that it's really an experience of going to shop. It's not like you're trying to see who can help me do what. It's really of an experience you're independent, you can do whatever you need, whatever you want. And then there's other separate little services that you can go around. Yeah. And they're all separate entities within the same building.
What's interesting is we're the only thing in the country similar to this. There's nothing else in the United States that aligns with our model, which is really amazing. So I think it's, like you said, it's very something that when I walk in, I even feel very welcomed. And the feedback that we get from our clients, if you look at our Google reviews, when I came on, I'm checking everything when I came on board. I'm like, how does every center have above 4.5? But it's just because that customer service is so important to us, especially because there's a lot of stigma around WIC specifically.
Yes.
It's very interesting. There's a lot of stigma. There's also a lot of people that don't utilize the benefits or apply even if they're eligible. So we really want to create a safe space and a space that they feel inclined to come back, but also tell their friends about it and really try to utilize it.
in terms of people not using the benefits, we've talked about advocating for yourself, and being able to take that step. How can an organization also advocate for their staff? And then what does it look like for that organization to do that?
I think it's awareness. I think it comes from the top, right? So, what's interesting is only 50% of the population that's eligible for WIC redeems it, or is on the program. So there's 50% that is eligible but does not get WIC benefits. And thinking about that population and thinking about it from an organization standpoint, there's employees, there's staff, that is eligible. And maybe they don't know about it. Maybe they think that, I'm working, so I don't qualify for those things. Maybe, like I said before, there's a lot of shame in it. But think about it coming from a leader. Like, if you are a leader in an organization and you know this information and you think that you have staff or others that could benefit from it, share that information, right? Like, be that bridge and bridge that gap between the need and the actual kind of redemption of it. Because I think when it comes from a leader, something feels different about that. It kind of feels like it is validating it, right? And there's a piece where, this person cares about me as a person and how I live outside of here. I'm not just a number to them. And so advocating and having that awareness to your staff, I think, is the biggest step.
Yeah, I think it really reflects on the culture of where we're working, right?
Absolutely.
There's a lot of places and organizations that claim, we're family here, we're family here. But seriously, what are we doing for our family?
Yes.
What are we doing for our family? How are we helping our family out? So I think that's very important to create that culture where maybe you're there to ask for help, maybe you don't want to ask for help, but just having that information there is important. Not necessarily just, just saying, I think you need something. It's just not even stigmatized. It's just this is what we have. This is information we have in Jennifer for everyone.
Absolutely.
And just have people who need it, take it as needed.
Yeah.
And it also might even raise your employee productivity.
Absolutely.
And mental health, like you said, they do go both in hand. And if your needs are not being met outside, how are you
able to show up?
Exactly. How are you able to just
you don't have the necessities. No, totally. When I was kind of thinking about this podcast today, and we had several conversations before, the biggest thing that kind of shocks me as both a dietitian in this space but also working in mental health is the hustle culture that we work in.
Yes.
And there's this weird thing where it's I'm above eating. I don't need to eat. I just am so productive. I don't need a lunch break.
You're reading my story right now.
You're not talking about me.
Right.
No, and I'm the same. Trust me, I'm the same way. I haven't had. Let me give you a prime example. So my current job, right? Catholic Charities, you have to take an hour lunch break. And I'm a salaried, it doesn't matter. I'm not hourly, but I have to take an hour. And I'm not saying that someone's have to take an hour, but it's part of my day and it's heavily encouraged, heavily encouraged. That is so different from every other place I've ever worked in where it's you're taking a break and we have this much to do. You're taking a 30-minute lunch break. You're taking an hour. They might have an aneurysm. Right. Because it just was so low. And that's so funny, right? Because we were working with eating disorders and it's what do you mean I can't have a lunch break? What are we talking about? But I think it really was ingrained in so many workplaces.
Yeah.
But the reality, and I'm so sorry to cut you off, but the reality is one, we know that undernourishment and inadequate nourishment is correlated with chronic disease.
Yeah.
Okay, so we can put that on the table outside of the workplace. But we know in the workplace, if people are undernourished, cognitively, they're not functioning at full capacity. Their attention is not at full capacity. Their mood is affected. I get hangry. I'm not pleasant.
You're not yourself.
No, and that's something that's I think sometimes overlooked because I don't know, maybe we don't connect the dots or maybe again the work is more important. But at the end of the day, like, what is the quality? And I would say that, like, you don't know until you're in a different space and you have like context to it, but it makes a massive impact.
Yes, it makes massive impact, and you're saying not only for the individual who's working, but that affects their nutrition. But they're also thinking about if they have a family, they have kids that they have to pick up and have a snack and whatever. And if they don't have that available to them, they're thinking about what's the next few days gonna look like, what's the next week's gonna look like, and that's a lot of pressure to put up for a full-time job. You know?
Yeah. And then you come home and it's like, then you have a whole nother thing that you have to do, and you're still behind the mark nutritionally. How are you going to show up and pick up your kids, be present for them, help them with their homework, prepare dinner, prepare for the next day? It's really hard. And I think that's really unfortunate. And I wish that there was more emphasis on making sure that your employees are good, both emotionally, but also nutritionally, throughout the day.
Our workspace too is supportive. We also have like take your hour lunch break, and then before pre-pandemic was like take it before 2 so it can actually come for lunch and not just a late early dinner, late lunch kind of thing. But it's a different space now because we're in a hybrid mode too. So we also have to remember that when we're home and we're here snacking here and there, you also have to be present when you are eating.
Absolutely. It's a
having
totally
nutrition.
different experience.
It's a different experience because, you know, sometimes you're working at the same time you're having stuff and you mindlessly kind of eat, and then you're still hungry at the end of it, but because you weren't there in your present moment.
Absolutely. So your body's not connecting, right? It's those hunger and fullness cues aren't there because we're not there, right? We're in something else.
Yeah. So we also have to make sure that even though if you do have the time to do all of that, you still have to be present and make sure you're taking care of yourself and putting yourself first, even though maybe there's other priorities. But if you're not functioning properly, then anything else you're trying to take care of is not going to function properly.
Or it's just like poor execution, right? Yeah, we can do a million things, but if we do them all bad, then like, what are we really doing? So I think there's a lot of focus that needs to be there, and hopefully we can get there someday.
So we kind of touched on WIC groceries and the WIC clinic. Until you mentioned WIC groceries in our previous interview, I did not know there was such a thing as WIC groceries.
Same.
So could you just a little bit just go more in depth of WIC grocery again and then WIC clinic, the versus each other? Is there a difference? And then who's eligible and who's not?
Yeah, totally. So it's funny you say that because like I had no idea what WIC grocery, like I said, I didn't know what WIC was, let alone WIC grocery. When I was applying for this job, I just like, hey, like community nutrition. I knew I really liked community from, you know, when I was in college and doing my rotations. I'm like, why not? Catholic Charities seems like a really good place to work, which it absolutely is. Love it. Best decision of my life. I had no idea. And honestly, if you passed by one, you still wouldn't really know, which we're working on because these centers are 30 years old and the branding WIC grocery is very new. I would say in the past, like maybe 4 years. Don't quote me on that, but I know it's relatively recent. So if you drive past one of our centers, it'll say WIC Food and Nutrition Center. And then it has like a million logos. Like it has like IDHS, it has like Catholic Charities logos. WIC grocery is not anywhere on the site.
We can relate with all of the little signs. We have titles that we have.
So I'll start there of like, if you see a WIC grocery, you probably won't recognize it. The good thing is that we are moving to shift that branding and make it something that is visible, unless you're, you know, not just looking for it. So WIC grocery, like I said, came about as a result of like the fraud that was happening in Chicago. Catholic Charities was already doing a lot of work in the advocacy and hunger space. So it kind of was like an ideal partnership, right? Like they already had the infrastructure to set up something like this, and the state wanted to set up infrastructure like this. So that's where the partnership came about, and it started as a pilot program. So they started with 4 centers in 1993. I wish I knew the 4 centers off the top of my head. I don't. I know they were located near the housing projects in that time. I want to say that what was the one that was near downtown? I'm not gonna remember it. It's okay. So there was 4 of them. There was 4 originally, and they were a massive success. Massive success. And then so they expanded. And we got up to 18 at one point, and now we're at around 14, and we are actually launching a mobile WIC grocery hopefully later this year. So a lot of logistic things, but we'll have a mobile unit that's focused in the Austin and West Garfield Park area. So WIC Grocery, like I said, is a partnership with the state. So we are state funded, and we provide 100% WIC approved products at all 14 locations. So if you come into our center, everything in the center is WIC approved, and we have every single food category in formula, as well as specialty formulas. And so as long as it's on your benefits, it's going to be in the center in some capacity. And then we don't only have kind of like the grocery setup, but we also provide nutrition education at point of service. So we have nutrition associates that provide nutrition education as they're shopping and support as they're shopping. Because I don't know if you've ever seen a WIC printout, but it makes no sense. You get like 36 ounces of cereal, a pound of cheese, a carton of beans. What does that mean? They know, you know what I mean? Our staff knows, but if you're a new WIC client, it's very confusing. So they walk you through the center. We also do recipe testing, because not only do we want people to redeem the benefits, but we want them to actually use it and have ideas for recipes. So we do that as well. And then we are co-located with many programs. So like I was saying, one of our grocery centers has a mom's hub kind of in the lower level, where we have a doula program. We have parenting, home visiting programs. And then kind of looking at a greater picture, we partner with services like Ladder Up that provide tax services. So they'll set up a table in our center, and they provide free tax preparation. They actually saved over $1 million. They $1 million in refunds for clients.
So it's a one-stop
At no
shop.
cost. Yeah. So we have a lot of supports and partners outside of just the grocery shopping.
Yeah.
So that is WIC Grocery in a nutshell, which is a lot of information, but kind of to shorten it up, we are a 100% WIC approved center that provides groceries, but also wraparound support services. And then the mobile is in the works. WIC clinics do the clinical side.
Okay.
So if you're like, hey, I want to get on WIC, you're going to contact a WIC clinic. And you are going to go in with all of your information that you need, and you're going to be seen by them, and they're going to say like, yes, you meet all of the requirements, or no, maybe you don't. And if yes, you meet all the requirements, then they will give you a benefit package, and you'll leave that day with a benefit card. And then once you get the card, then you can come to us.
Oh, so right away.
Right away.
That's
And
awesome.
the good thing is that we have 5 co-located clinics. So like we are here and they are next door.
Oh, okay.
So at our Roseland location, we share the building that's literally right around the hall. And so a lot of times, right, clients will get their benefit card, and then the clinic will send them over to us, and we'll give them a tour and walk them through their benefits, and they can redeem them if they want that day. So clinical side is the WIC clinics. They manage the actual benefits on the card, and whether or not you're going to get benefits and how much benefits you're going to get. And they provide that required nutrition education. And like I said, they have 4 appointments a year that they have to complete. But once they have that card and there's stuff on that card, they can come to us. We don't take any cash or anything like that. So you have to be a WIC participant too.
See, I think that's where, at least for me, the mesh between WIC groceries and WIC clinic came, because
It's confusing.
since I had the privilege of doing some direct education, like at Roseland, I'm like, oh, they're all within one building. It's all one entity. But there is, different jobs for different things. I mean, that's within our organization too.
Yeah.
We're part of such a bigger umbrella.
Yeah.
all of us within this organization have such a niche like dedication to stuff, and then within us we still have other little groups that take care of other little things. So but it really helps trying to really focus our attention, to specific needs.
Well, for clients too, it's confusing because they'll come to us and be like, why are my benefits on? We're like, I haven't. That's a good idea.
Yes.
Your guess is as good as mine. However, we are able to connect them with their clinic and say, because we have a really good working relationship with the clinics, especially our co-located ones, because there's many that we're not co-located with. But we have such a close partnership with the state that we try to attend their meetings and things like that just to make sure we're all in the loop and we're all supporting clients in the best way we can.
And what would you say would be the future plans of WIC Grocery? I know you mentioned the mobile farm, but apart from the mobile things, what are the next plans for WIC Grocery?
Well, I'll expand on that too a little bit. Yeah, I would say like the biggest plan is the mobile truck, right? And the reason why is just kind of a little backstory. We had a location in that West East Garfield Park area, which has a very high like WIC population. The store was empty all the time. Not a soul. It was actually one of the first ones I visited, and I was like, oh, okay, what's going on here? The area is very dangerous. And that was a lot of the feedback is like moms were like, I don't feel safe coming on that block and shopping there. And so in efforts to really create a safe space that maybe meets them more where they're at, that's where the mobile initiative came out of. And so that's where our focus is going to be for a while, is really getting that up and running, because we know, that community can benefit, and that's where it came out of. But think about like maybe like a Head Start, right? And partnering up with them, and we park our truck outside, and parents that maybe never even thought about WIC and that are WIC eligible now have a chance, or maybe they do have WIC and they haven't been able to get to a grocery store. Now it's right there for them, right?
Transportation is an issue, one less stop you have to make.
Yeah. And our goal too is to partner with, and I guess that scenario kind of aligns with this. Our goal is to partner with mobile WIC clinics as well. So they can, again, do both. Like, maybe again, you're picking up your kids from daycare or Head Start or wherever, and you're able to sign up for benefits right there. And not only do you get your card right then, hop on the truck and come do your first shopping experience. So that's the biggest thing. But in terms of like my focus, which is nutrition services, we are really aiming to provide quality nutrition and cooking experiences to our moms at no cost. So right now we already do in-person classes, which is in partnership with cphp. But we also offer virtual classes, and that's through Illinois Extension. So those are annual programs. But we want to do more. What we're hearing from these moms is like, we love this and we want more of this, not just twice a year. And so our aim is to be able to offer monthly or even weekly offerings at various locations and have it be a variety of things. Maybe some are just basic demos, right, with nutrition education. And then maybe some are more hands-on. If we have a small intimate group of 5 moms and they prepare a meal together and everyone has a part, and they sit down and have that meal together to build that community. So we really want to give a lot of opportunities, because right now we're able to offer services to a small population that we serve, but we really want to expand that and have the opportunity for every mom or parent or caregiver that shops with us to have an option to have a nutrition experience.
That is awesome. Yeah, I mean, all of that planning sounds so great. I know it takes a lot of effort, a lot of people to put it all together.
But I think the good thing is it's doable, and when everyone's passionate about it, you can get things done.
It's very much worth it. Whatever, effort that is put in there, it's very much appreciated by the community.
Absolutely.
They come and seek those services as well, so it's needed.
Yeah. They want it. Here's the thing too, is like newer moms, what I found is they don't really cook for many reasons. They don't have time. Maybe, they weren't necessarily in a household where they were taught to cook, or maybe they didn't have access to cook. Maybe they were unhoused in some capacity. Like, there's so many factors. And so now they're like, oh, I don't do those things because I don't feel confident I don't know what to do with those things. And so we really want to bridge that gap and say, like, hey, here's really simple things that aren't just like nutritious, but good. I think that's my biggest gripe with healthy eating is because I'm like, this recipe doesn't have an ounce of seasoning. Do you want people to cook this? You know what I mean? Or like if you taste it and you don't like it, why would they like it? So we recipe test everything.
Same thing you do here.
We recipe test, and I swear, when we set every month we have a new recipe, I will eat that recipe testing it like 7 or 8 times. And so by the time they're sampling it, they'll be like, "Do you want one?" I'm like, "Please get it. I already know what's on." So good.
Hey, but that's the perks of the job. At least you get to
but we really, and we get input from our staff as well. So we recipe test it with our staff and make sure we get their input too. But that's important, you know. We want to make sure that moms are not only getting in the information, but they can really utilize it to better themselves and their family. On Instagram and Facebook at wicgrocery. We update that weekly, and that'll be recipes, program updates, you know, especially when we have new things going on, whether that's cooking schools or our farmers market, all of that information is there. And then our website, wicgrocery.org. So as long as you type in wicgrocery, you'll find us.
Thank you so much for being here.
Thank you.
Your time, your knowledge, you know. We've been partnered up for a while.
Yeah.
So hopefully that continues as well.
Absolutely.
And thank you for all of this.
Yes, of course. Thank you both. Appreciate it.
Thanks for listening to Healthier Habits with your hosts, Cassandra Zumba.
And Yakwachi.
We hope you enjoyed this conversation. Keep an eye out for more episodes and make sure to subscribe and hit the notification bell.
Here at cphp, we have the eatmovesave meal kit. This is an e-commerce project dedicated to improving and resolving access to healthy and affordable foods through a meal kit, which is packaged and delivered directly to a family's home throughout Chicago through Talkbox. Visit our eatmovesave website for more information on meal kit ordering and delivery.
You can help support the podcast by liking, sharing, and subscribing, following us on our social media accounts on Instagram as eatmovesave Chicago, Facebook eatmovesave Chicago, and YouTube as UIC OCEAN-HP. Look for the podcast tab for more episodes.
If you'd like more information on partnering with our organization, head over to our website, cphp.uic.edu, and send us a message.
Thank you for joining this chat. Check out our links and resources in the description. See you next time.
Bye.
This institution is an equal opportunity provider. This material is funded by the USDA Supplemental Nutrition Assistance Program, SNAP. Chicago Partnership for Health Promotion is a unit of the Office of Community Engagement and Neighborhood Health Partnerships, representing a network of community-based interventions designed to improve nutrition and reduce disparities in outcomes associated with nutritional diseases, including obesity. CPHP provides high-quality, age, gender, and culturally tailored nutrition education in various venues across the city.
Eat, Move, Save.